Hi, everybody. Thank you for being here today. I wanted to just introduce myself really quick in case you don't know me. I am a functional medicine nurse practitioner, initially trained in emergency medicine, and I've been an NP for about 22 years. Can you believe it? And career started out being an EMT and loved it, fell in love with it, became an ER nurse, and then became an acute care nurse practitioner with a subspecialty in emergency trauma. After doing that for a while, I really started to dig into functional medicine after I was diagnosed with lupus in 2000 and first started feeling symptoms in 06 and then diagnosed in 07. And it's been quite the journey. And so what I do today is I help women overcome autoimmune conditions using functional medicine, finding the root cause. And it's something I love. It's something I'm so passionate about. So today we're talking all about the different infections that actually trigger lupus. So let me share this and we will get started. All right. All right, here we go. So today we're talking about acute and chronic infections that lead to autoimmunity, how to test and how to treat. I will say, disclaimer, this is not medical advice. I am not your primary care provider or your rheumatologist. And so this is for educational purposes only. So we're going to be talking about these infections: Epstein-Barr virus, cytomegalovirus, herpes, influenza, oral infections, H. pylori, parasites, and candida, and COVID. All right, so Epstein-Barr virus, it is hands down the virus that causes autoimmune conditions. Every single one of my clients tests positive for Epstein-Barr virus, every single one of them. And so I know this may be a little difficult to read, but I wanted to show you this. And sometimes it is, at times you really have to kind of think about when do the symptoms start? How long have you had them? Because these can be a little confusing, and you don't necessarily need to learn how to interpret this yourself, because if you're going to get this done, it's going to either come from your primary care, or if you just like to work with me, then you'll have someone interpret this for you. But it's going to show whether you have an acute infection now, whether you had a major one in the past, or if you have reactivation. And reactivation happens when you're stressed, when you're not sleeping, when you're not eating well. And so Epstein-Barr virus, it is one hell of a virus. Let me just tell you, Epstein-Barr is a pain in the neck because it's just hanging out and it's waiting for you to like not eat good, not sleep well, be really super stressed, not doing enough self-care. And then it will rear its ugly head. 10 out of 10 of my clients have a history of Epstein-Barr virus. So some of the things to do to treat this: definitely vitamin D. You guys have vitamin D at home, vitamin D3. Have a good, don't get Nature's, is it called Nature's Gate? It's got like soybean, like GMO toxic soybean oil. So stay away from that. So vitamin D. Typically I have my clients taking 5,000 IUs. If you have an acute Epstein-Barr virus, you want to bump that up to 10K, probably for about 2 weeks. Zinc, CoQ10. CoQ10 is great for the mitochondria. NAC. I know there've been a lot of talk about NAC in the news, like they're eradicating it. I don't have a problem getting NAC. So if you need some, you just let me know. Alpha lipoic acid. This helps with so many different things. Oh my gosh, not only with helping with Epstein-Barr, alpha lipoic acid also helps with insulin resistance. It also has been shown to detox some metals. Vitamin C, lysine, also really good, 1,000 milligrams twice a day. And do not use it with hemochromatosis because it can also increase cholesterol levels. So it's not something you want to be on like forever. Definitely not. Just acutely, I would be on this. And you want to take it in between meals. Biggest thing with Epstein-Barr, like I mentioned before, make sure you're sleeping well. Make sure you're eating right. Decrease your stress. Go for a walk. Be in nature. Meditate. You can also do guided meditation. If you don't think you can just sit there in silence, guided meditations are amazing. A couple of the apps would be Calm, CALM, as well as Envol, ENVOL. I just discovered that and I love it. So try that out. Some of the symptoms would be fever, swollen lymph nodes for sure. And some people actually have lymph nodes enlarged from a past Epstein-Barr infection. And so that's pretty common. Abdominal pain, enlarged spleen, also elevated liver functions and a sore throat. And fatigue. Fatigue is the hallmark sign. Cytomegalovirus. And the way to test this would be just a simple IgG and an IgM. And treatment would be very similar to Epstein-Barr. Herpes. So, we've got herpes 1, simplex 1 and 2. I'm going to check IgG and IgM. This is typically included in an STD panel as well. But the other herpes that I really look at is called HHV6. And that you can literally pick up. It's not necessarily sexually transmitted, but you can pick up HHV6 from like standing in the subway and holding on to the metal bar. Literally. It's not that hard to not get this. It's another virus. And there's just so many viruses all around. But when you're in a packed subway car and you're around people and you're touching a place where a million other people have touched, and then let's say you're about to eat lunch and you don't wash your hands, I mean, it could be as easy as that. So some of the treatments here, vitamin C, D3, and zinc. These are like the 3 hallmark things to make sure you have at home. Lysine, 1,000 milligrams 3 times a day. And you also want to avoid these foods. Foods with high arginine are not good for herpes, such as nuts, beef, wheat germ, and chocolate. And coffee, red wine, and black tea can actually activate the virus. So if you feel like you've been burning the candle at both ends, you're going out with your friends late at night, you're not sleeping well, you're having fast foods, you're drinking the wine and all of that, it can easily trigger herpes, either 1 and 2, like a cold sore or genitally, or HHV6. So just be mindful of really taking care of yourself. Influenza. I mean, we all know about this, right? And the testing, it's pretty easy. They do usually a nasal swab for influenza A and B. Treatment, again, you got the zinc, vitamin D3, elderberry, and some of the symptoms we all know, fever, cough, body aches, sore throat. So for this, this happens mostly in the winter times, right? Between October and February. So I would be mindful, keep these things on hand, vitamin C, zinc, and vitamin D. And maybe start, if you're not someone that really takes supplements, this may be a good time to just take it during the times when there's going to be a lot of people that are sick around you. Vitamin D3, I would probably, get them checked. Actually, D3, get it checked in the blood. But I'd start with 5,000 IUs. Most people are deficient. Zinc, I would say 15 milligrams just regularly, 30 if you're starting to get sick. Oral infections, cavitations. You may not have heard about this. And I'm going to tell you something. My rheumatologist didn't say a word about this. Primary care provider, forget it. But it's so important. You know, your teeth and the health of your teeth reflect the health of your body. And when your body's not doing well, your teeth suffer. When your teeth are not doing well, your body suffers. This is why they give you antibiotics if they're going to be working on your teeth or doing some kind of procedure. And if you have like a heart issue, you know, like a valve issue, a murmur, or some type of one of the valves, like an issue with one of the tricuspid valves, you're going to need to be on antibiotics. And why is that? Because the teeth lead, it's part of your body. It's not separate. I don't know if people think it's separate. It just stops right here. It doesn't. It goes into your bloodstream. If you have infections in your mouth, it's going into your bloodstream. It's causing a inflammatory response. And lupus is about inflammation. Autoimmunity is about inflammation. So what are cavitations? It is when you get your wisdom teeth removed, when you get other teeth extracted, root canals. So when you remove a tooth, there's a hole there. What can happen is that hole, despite the fact that they suture it closed or that it closed on its own, infection, bacteria can harbor in there and harbor for years and years and years and decades. It's called a cavitation, where it's closed, but you've got infection in there. And you don't have to feel pain. You don't have to feel pain or swelling, nothing. You do not need to feel anything. You sort of go through life sort of not knowing. But cavitations are real and it happens every single day. It's just that not enough people know about it. They're not aware of it. They don't know how to even get it checked out, but we're going to talk about that. What happens is not only does the area where you got the tooth pulled harbor bacteria, it can also hold on to Lyme. Lyme loves those pockets. They love being in there. They get in there through your bloodstream. Fungus, viruses, it all can harbor in there. And if you're like, I don't know where, how I'm getting, why I'm so sick. Why do I have candida? I can't seem to get rid of candida. Maybe it's because it's in in the cavitations in your teeth. So who does this? A normal dentist, not likely. It's a biological dentist. You can Google it. You can find someone near you. I'm actually taking my parents. I have someone that came highly recommended in Connecticut. It's about a 2-hour drive. So it can cause issues. TMJ, trigeminal neuralgia, eye infections, frequent eye infections, pink eye. I mean, it can cause headaches and ear stuff, ear infections, ringing. I mean, it can cause so many things. And you just don't think about it because you probably never heard of this, right? So the only way to actually know if you have cavitations is with something, you won't see it on x-ray. You will not see it on any dental x-ray. You'll only see it through something called a cone beam imaging. It's the only way it'll show up with a biological dentist. If you're looking for a biological dentist, make sure that they're certified, that it's somewhere on the page, it'll say like biological dentist. Okay, you just don't want to go to just anybody who has a cone beam because I don't know. I prefer to go to someone that if you have like a bad infection, someone that's able to give you like vitamin C IV infusion afterwards. You know what I mean? Cavitations, facial pain, TMJ, sinus infections, sinus congestion. If you're always congested, then someone's giving you antibiotics or you have pain all the time. You may want to get checked for cavitations. All right, H. pylori. Testing. Breath tests can be done at a local lab. Your primary or rheumatologist can order a breath test. Upper endoscopy, not so reliable, I will say. And this functional stool test. It is preferred and way more accurate. I've actually had people get an upper endoscopy, show me the results, negative H. pylori. We do the stool test, positive. The thing with that is the stool test looks for the DNA of these bacteria or viruses, the DNA. So it picks it up. It's very accurate. And so upper endoscopy, like, I don't know, unless they were looking for other things too, it's not my first choice by far. The stool testing is, because it gives me so much information. But if you wanted to just do that and you just wanted to have it covered by your insurance, I think it's covered. You can do the breath test. Now, if you go to your conventional medicine doc, I'm going to warn you about this. And you come back positive with that breath test, they're immediately going to put you on a Prep pack, which is 2 different antibiotics with Prevacid, 3 weeks total. That is going to be like a bomb. It's like a bomb dropped in your gut. It's going to kill everything. Not only H. pylori, let's hope, but it's going to get rid of your good bacteria. It's literally dropping a bomb in there. It's not, I will never do that. I've never done it. It's just not going to happen. I totally go with herbal 100%. And so these are some of the things that are really crucial. The zinc carnosine, masticagon, berberine. Bismuth is actually Pepto-Bismol. That's what Pepto-Bismol is. You want to treat it for at least 2 months. And you need to repeat the stool test. Now, the problem with breath test, I'm not sure if it gives you the full, like this is the strain of H. pylori you have, because in the stool test, you do get that. You do get that virulent strain A, B, or whatever it is, literally like 12 different types of H. pylori. You want to know if you have a virulent strain, because H. pylori left untreated becomes stomach cancer. If you have reflux issues, get checked for H. pylori. This is the problem. This is a problem that happens in conventional medicine. You go to your doctor, and you're like, I have reflux, I have a burning here. What do they do? What do they do? They give you a prescription for Nexium, omeprazole. Here you go. There you go. And so you would take it, and you take it for years. And then one day they discover you have stomach cancer because nobody bothered to check for H. pylori with reflux issues. It's a must. I would definitely get that checked. And once you're treated, you need to get it checked again. And usually for me, the stool testing is repeated after 4 months. It's a must, particularly virulent strains. I recently had a patient that came back positive, a virulent strain. I was like, oh, we gotta get this. We gotta kill this thing now. So I immediately put her on the herbals and then repeat the tests again in 4 months. I don't mess around with H. pylori, and neither should you. It's a big deal. It absolutely can easily become and turn into stomach cancer if left untreated. People go decades taking popping Tums, drinking Maalox, right? We see it all the time. We see it all the time. Sometimes the doctors will check for H. pylori. Sometimes breath test, maybe. Sometimes they're just Nexium, omeprazole. Do you know how many people are on omeprazole? I just want to say something about that. When you completely eradicate the acid in your stomach, One, you can't fully digest your food. Number two, you can't fully, that's like your body's protection. If you eat something that may have, I'm not going to say full blown, like you're eating oysters and, well, sometimes you eat oysters or some raw fish. If you don't have any acid that's going to kill a virus or bacteria that you're eating through the food that maybe wasn't fully cooked, you're sort of exposing yourself, you know? So you take years of omeprazole. That's what's happening. You're sort of leaving yourself open. The acid is there for a reason. It's to digest your stomach. To digest your food. You take that away, you're left open to whatever. You go to DR, you go to wherever, some island somewhere, and you're drinking contaminated water. You're going to pick up. You're going to pick up stuff. So having acid is not a terrible thing. Get checked for H. pylori. Here we go with the parasites. So one of the things that is really common with parasites, you have digestive issues. Sometimes you have weight loss, fatigue. You have so many symptoms that are shared with other things. So you're like, is this Epstein-Barr? Is it just that I'm not sleeping enough? Is it just that, I've just been having like fast food lately? And parasites are pretty common. And like I said, it comes in sushi. So one of the things that's really important to know with sushi especially is you want to avoid eel. You want to avoid tuna, especially Toro tuna, like the most expensive tuna, right? Isn't it like on the menu? It's like more expensive. It actually contains more parasites than regular tuna, but tuna in general, ever since I had the parasite, I no longer consume raw fish. If I were to do anything, I would pick the salmon and I would pick cooked things. And I would also do like the veggie ones, just, or even is it called the Philadelphia roll with the smoked salmon with the cream cheese? But if you're not doing dairy, then obviously you can't do that. But stay away from tuna and stay away from eel. Those are like the ones that contain the most parasites. All right, let's talk about these parasites a little bit. So tapeworms can grow 35 feet long. They live in your intestines and they lay 1 million eggs per day. Can you imagine? And they may have diarrhea. They may have severe constipation. I will say that when I had my parasite, I had I would say moderate amount of constipation, nothing major. Like I really, kind of like, this was way before. This is like before I was diagnosed, way before. It took a couple of years of being somewhat constipated for it to go from like mild, moderate to severe. And then I'd say about a year later, I was diagnosed. Giardia is another one. So I went to Zion National Park and I was playing in the water, the river. So cold water tends to have Giardia, not salt water. It's fresh water that you would find like in mountains. You know what I mean? That's when you would find Giardia, and it causes extreme diarrhea. I did not have diarrhea. I did not. Diarrhea leading to dehydration and to even death. So I would warn you, sometimes people like drink. They're like, oh my God, look at this beautiful water. It's like coming down from the waterfall, and they think that they can just like drink it. No, never do that. Unless you're actually coming with a filter system There's a lot of people who go camping, and there's like these special filters that if you run out of water, you can use some of that like river water or fresh water and put it in there, and it will filter it for you. Aside from that, if it looks clear as day, do not drink it. Okay, so obviously parasites thrive when your body is, when you're not well, when your body is run down, when your immune system is low, when you're immunocompromised, when you've got other pathogens, it kind of like takes over. It lives off of you. And it's really just, it's so common. It's more common than you think. By the way, I just wanted to read this to you in the first paragraph, that the hookworms work their way outside of the gut in order to feed on your blood, which leads to anemia. And I see so many people with anemia, and specifically autoimmunity, unless you have like really heavy periods every month. But that's another topic, because if you have really heavy periods or fibroids, and that sounds like estrogen dominance. And so that could sometimes be alleviated with some compounded progesterone. But anyway, anemia is very prevalent. And when I see anemia and I see other sort of deficiencies, iron, B12, magnesium, like if I see a bunch of vitamin deficiencies, I think, okay, there is a permeability issue. There is leaky gut. This person has leaky gut. And so why do they have leaky gut? And that's when I do the stool test on them. Okay, so testing for parasites. Functional stool test, like the one I do, upper endoscopy, a colonoscopy, and you can do stool testing from a local lab. I think that is super subpar. That is probably one of the worst tests, but it's one of the only ones that I'm almost positive your primary will be like, oh yeah, here's a little thing, bring this in, and we'll submit it to the local lab. No, because it'll most likely come back negative. It gives you literally, because I've seen this, half of a page of results, maybe one full page of results. Ova, ONP, which is ova and parasite, positive or negative. It gives you nothing else. The stool test that I use gives me a list of all of the worms, all of the different parasites, and it's just an invaluable test. So treatment depends on the parasite. There's so many like over-the-counter parasite detox cleanses of all kinds. I would say, you know, and I've seen people do this. I see people trying to be on a detox when they're really ill, and that's not a good idea, because your body can't handle a detox. It doesn't have enough reserves to go through a detox cleanse. You sort of have to build yourself first, supplement, start to eat really well, sleep really well, and uncovering other things from your blood work before you even touch a detox. Like, don't do it. I've seen people just get really sick that way. And you also don't know if, you know, are your detox pathways open? Your gallbladder, you know, if you're constipated, don't even try a detox. No way, because you'll get so sick. You're just going to recirculate that. If your liver actually, you've got phase 1 and phase 2 detoxification that your liver must go through. If it's impaired, if you have methylation issues and you're trying to do a detox because you think it will just like cleanse you, no. What happens is if you have impaired phase 1 or phase 2 detoxification, those toxins will recirculate back in your body. They won't be able to leave because your body just isn't fully equipped yet. You need particular vitamins in order for that to happen. So I would say leave the detox, work with someone if you're going to detox. So make sure your pathways are opened. And I wouldn't sort of randomly buy something over the counter and just do it. Because if you're ill, I just wouldn't. You'll feel really sick and it really won't help you. Okay, so a couple of ways to treat here. There's obviously conventional medicine, there's prescription. Mebendazole, which is Enverm, Albenza, you need prescription for this. And sometimes people want this because it's quick, it's fast. I did that. So I don't really see a problem with that, to be honest with you. For herbals, woodworm, berberine, black walnut, garlic, pumpkin seed, grapefruit seed extract. Paragard from Integrative Therapeutics is a really nice blend. You can try that. If you're going to be doing it this way, I would say you have to do it for 4 to 6 weeks at least. It all depends what your symptoms are, what the results were that actually showed you had a parasite, how bad it was. Like if it's mild, 4 to 6 weeks. If it's really bad or you have multiple, you may want to do it for a little bit longer. Okay, next one is Candida. All right, so Candida, I see this sometimes. I'm actually surprised I don't see it enough. So Candida is a fungal infection and it's a yeast infection. It's in your gut. It can also be in your vagina, of course, yeast infections. It can be due to lots of antibiotics, eating sugar, eating lots of candy and chocolate. If you're immunocompromised, people get this pretty easily. Obviously, if you have chronic illness, diabetes, uncontrolled diabetes, definitely, it's so easy for someone to get Candida. They get it on their skin, they get it underneath their breasts, underneath here. You can see it on the skin, in their groin area as well. Birth control pills can easily cause Candida, as well as estrogen hormone replacement. Some of the symptoms here, constipation, brain fog, fatigue, autoimmune conditions. There's, I would say 40% of the time, there's a skin condition. There's eczema. There's some form of a rash. IBS. There's also anxiety. And it's always, not always, I'll say it could be related to anxiety or depression, because when you have an infection and it's causing permeability issues, a lot of people tend to become depressed or have anxiety disorders because the most amount of serotonin that's being produced in your body is not in your brain, it's in your gut. So when your gut is compromised, you can develop anything, and it'll cause permeability issues. Candida is one of them. But you can also get depression from just having a leaky gut, from parasites or from Klebsiella or some other bacteria or virus. You'll also see sometimes thyroid issues, but thyroid issues are related to the gut. And so there's a direct correlation there with thyroid and gut issues. And it leads to, a leaky gut. How you want to do the test, again, functional stool testing. I've done blood work to compare. I've done this a couple of times with my clients in the past. You can get Candida and you can get it done in the blood work. So I've done it. I'd have a positive stool Candida and then a negative blood sample. So it's not a good test. I think sometimes primary care providers will be like, oh, let's test you in the blood. It's not a good test. I've never found it to be, I've never found it in the blood and also have found it in the stool. I always find it in the stool and never in the blood. So I don't think it's a really good test. It's not a good option. treatment is, of course, eliminating sugar. That's the biggest one, and carbs, like simple carbs, pasta and potatoes. And you want to do an elimination of the sugar and the simple carbs very strictly for 2 weeks. But Candida diet, you probably are going to be doing that for at least 8 weeks, at least 8 weeks. So Candida is not necessarily easy to eradicate. It takes time, sometimes even 3 months worth of treatment. All right, some of the things you want to avoid for sure: fermented foods, vinegar, kimchi, sauerkraut, and then all the things that contain a lot of sugar: dried fruit, fruit in general, grains, alcohol, dairy, potatoes. Oops, I misspelled that. Yams, beets, coffee. A lot of coffee out there has mold in it. So you want to pick, there is purity coffee, there's bulletproof coffee as well that are tested for mold. If it does not actually say we test for mold, every coffee, Starbucks, Dunkin' Donuts is probably the worst. Starbucks has mold in it. And so if you're a coffee drinker, then I would look into purity. I do have a like a 10% off code, which I can put into the email once I send this out. So you definitely want to watch the mold that's coming in your coffee. Like if you're getting something from just like a regular supermarket, that all has mold in it. And you want to eat things like non-starchy foods. You want to have some cooked greens rather than raw, is what I meant there, rather than raw. I would say raw is a little bit hard on the digestion. And if we're working on the digestion, you do not want to consume raw. Everything should be cooked while we are working on the gut. Bone broth is amazing. Grass-fed meats, organic chicken, all really good. So, you know, kind of stick to like a paleo-ish diet, which is, you know, grass-fed beef or chicken or a Atlantic salmon. Stay away from farm-raised fish. And I would also hold on the fruit, particularly things that are like oranges, bananas are probably the worst. Once you're done with the 2 weeks, you can start incorporating berries in. So treatment here. Caprylic acid actually breaks down the wall of Candida. Oregano, garlic, probiotics. And you may need to, you know, like I said, treat this for even up to 3 months time. Diflucan, right? It's so popular. I think it's one of the most, not recommended, the most requested medication when I was working at the urgent care. If they were given a prescription for an antibiotic, then women right away wanted the diflucan. I don't necessarily have issues with diflucan, but it does cause QT prolongation, which affects your heart. And it does not mix with antidepressants. And so many women I found were on antidepressants. And so I didn't feel comfortable. Plus the QT prolongation, why would I want that? So I'd rather take a supplement that doesn't cause that and change my diet for a few months, you know, rather than doing that. Nystatin is another one. I've done nystatin in the past. It is a prescription. It is not over the counter. It comes in liquid. It comes in tablets too. All right, COVID. I have a lot to say about this. First, if you've had COVID and you end up with something called long haulers. Long haulers is the fatigue, you feel drained, maybe you have headaches that are persistent. It is 1000% due to obviously continued inflammation and how it's been affecting the mitochondria in your cell. There was this new report that just came out Frontiers of Molecular Bioscience in this year that claim that post-COVID is causing multi-system inflammation, leading to lupus and Guillain-Barré. So it's saying that, and I'm quoting here with them, severe immune activation, cytokine storms, meaning your body suddenly is like up in arms trying to kill COVID. Moreover, patients with SLE, lupus, can develop cytokine storms. And these are all the cytokines that it's causing an elevation, and more easily. So now, I have a history of lupus. It's no longer shows up in my blood work, and I had COVID and it was extremely mild. It felt like a little cold. And this was April of last year. So I think that if you are currently have active lupus or you're in a flare, you're most likely going to get long haulers. And I do have on the bottom here, long haulers, I do have on my podcast, the Sacred Medicine podcast, episode 210. I'm talking to one of my colleagues and he specializes in this. And so we talked all about it, what to take, what to do. It's a great interview, so I would listen in on that. That alone would be like an hour lecture, honestly. In the midst of acute COVID, this is not medical advice. Vitamin D, A, zinc, vitamin C, glutathione, it depends on symptoms. And so this is why I think people should just have on hand these supplements for sure. And if you're traveling and you're about to board a plane, this is what I do. I will take all of these the morning of, before I get on the plane, to make sure that my immune system's just like, we're good, to not get anything, because people are not wearing masks right now on the planes. Personally, I think people are traveling with COVID and they may think that it's allergies, or they may think that it's nothing. And so I put a mask on if I'm on a plane, just because I had a cougher the other day who was coughing and had so much phlegm. So why take the chance? Personally, that's just me. And then I wanted to mention something about what I have been finding with my lupus clients after they have had immunization, the COVID vaccine. And I want to say that two things. One is I have seen such a rise in positive ANAs. I have people coming to me who've gotten the vaccine. 3 months later, they're testing positive for lupus. And this is with almost every single person that has been vaccinated that I'm seeing. And it's incredible to me. And I do not recommend it. In general, I do not recommend it. Why? Just because of what I've been seeing. If you have had it, I would, now this is not medical advice. This is my recommendation or opinion about this from what I've been seeing clinically. If you've been vaccinated, I wouldn't get boosters. If you have an autoimmune condition and you think that that is going to save you, and you're like extremely fearful and you just need to have it, then that is your decision completely. And I respect that. But why not reverse the lupus? Why not start like getting rid of all these other infections? You know what I mean? And feel better so that your body is actually able to fight this, rather than putting something in you that is still considered experimental You know, I think that it's just I really have a lot of thoughts about this, but it's not something that I chose to put in my body. And when I have had patients who have worked with me that haven't they didn't have the vaccine, they worked with me and we did all of this work for months, getting rid of their lupus, having them feel better. I had a woman who, when she first started with me, she could barely walk from her bedroom to the bathroom or from the kitchen to the bathroom. She was in so much pain. I got her to a place where she was able to walk for 4 hours in Disneyland. She decides to get the vaccine. And we're starting from square one. Literally 6 months down the drain. Symptoms came back, everything. It's totally your body and you can do whatever you want, but I want to just tell you what I've been seeing clinically with my patients. Let's see here. I think this is the last. Yes, it is. Okay. So let me stop sharing and let me get to some questions. I think I have one here. Will we get a copy of this? Oh, yes, you will. He'll have it emailed to you. I'm going to just do the beginning part again and then put them together, and then we'll be emailing them. So I'm open to questions. If whoever wants to answer, you can either write it in chat or you can just unmute yourself.
I have a few questions.
Yes.
Hi. I was curious about any of those more long-standing viruses, like ones that we probably got in childhood. So I had EBV when I was like 10 years old. I was hospitalized for it because I had some other things that were going on. And a lot of the other ones that you chatted about, I've had some positive labs for them as well. And so I was wondering if those are passed to our children, like in utero or through breast milk. And how that works. Like I know like Lyme, like certain bacteria of Lyme, aren't they passed through breast milk and things like that? So I was just kind of curious about that.
That's such a good question. So now I've never heard of a study personally of Epstein-Barr being transferred over, but I believe parasites are, and obviously herpes, right? Vaginal herpes through vaginal delivery. But I've never heard of Epstein-Barr passing through. So, but that's a really, really good question. I would have to look that up.
Yeah, I'm curious about that.
Yeah.
A few other questions. So, for the H. pylori, so you gave us the oral or the herbal. Like, how much of that would we take? Like, as far as so zinc and
so
all that. Like, what would we how much would we take?
Okay, great question. So there is one supplement that I've used. It's called Pylori X, and it has all of those ingredients in it.
Okay.
And I would typically do depending on the severity and if you have a virulent strain or not. So it really is dependent on how much, but typically it's it could be anywhere between 1 tablet twice a day to 2 tablets twice a day. Sometimes it's 4 weeks, sometimes it's 6 or 8. Depending on what I find on the test.
Okay. Thank you.
Sure. Anybody else?
Hi, Margaret. This is Nubia. How are you?
Hi, good.
Thank you so much for all the information. It's been really helpful.
Awesome.
I'm glad that you mentioned the fact about the booster, because I had gotten my first 2 vaccines and have not gotten the booster. And there was just, I've been seeing functional medicine doctors for a while now. And, kind of was diagnosed with Epstein-Barr in my late 20s. Now I'm in my 40s, and it's just been sort of this journey of, ups and downs and getting a little bit better, but then kind of going back. So after getting the second vaccination, I did end up getting COVID at the beginning of this year for the first time, and I got it really, really bad. And so I'm just glad that you mentioned that about the booster, because I was really on the fence because I was worried about getting sick again, having not gotten the booster.
Do you have an autoimmune issue?
Yeah. So when in my late 20s, it was sort of it took a while to get there, but my internist found that I had Epstein-Barr, and they kept saying I had fibromyalgia because I went from being high functioning to having a lot of fatigue. They ended up finding a positive titer, but it wasn't high enough. And so my rheumatologist at the time basically said, we'll treat you when it's high enough. And that was I think that was the point in my life where I was like, I'm not going to wait to get a full-blown thing to kind of get treatment. So then that's kind of when I went the functional medicine route. But I think it's just been a journey, and I'm still looking for someone to be able to kind of, walk alongside me, because I feel like there's so many things and it can get pretty overwhelming. And so that's why I'm really excited about how you have focused on sort of these infections, because I think it all started with the gut infection.
Oh, it always starts in the gut.
Mm-hmm.
Yeah. That's why it's one of the first tests I do. And blood work also to check. I check on vitamins and heavy metals and all that stuff. So because it gives me an idea on if you've got low reserves or good reserves. Most people have very low reserves. So what I do is I build up the reserves. So then, it's possible that, you got the vaccine and then you still got COVID. So, I've been hearing, who doesn't hear this, right? Like, oh yeah, I got, triple vaxxed and then they're getting sick. So I'm like, what's the point? What's the point?
Right. Yeah. Yeah. So thank you for mentioning that. But I did want to ask you, in terms of becoming a client, like a personal one-on-one client, what would be the avenue to take for that?
Oh, okay. Great question. So I do meet and greets, but I also wanted to mention that I also do, in case, I do have a couple of links for you guys before I forget. If you wanted to get any of the tests done, I'm going to just put that here. If you wanted to purchase the stool test, I'm going to put the link here. And if you wanted with that, because there's also a couple of options to have the results reviewed by me.
Okay.
Or not, or you can choose to, I don't know, maybe, it would be too hard for you to interpret on your own, but these are a couple of, see, did that make it? Oh yeah, okay.
Yeah, I got this.
Okay, and then I've got also the meet and greet, which is free. It's a free call, about 20 to 30 minutes. And then I can talk about how I work with women.
Oh, wonderful. Good. I'm looking forward to that. Thank you.
And there it is right there.
Wonderful. Thank you.
You're welcome.
It's really interesting that we're talking about the vaccine and everything, because like you, I got the vaccine, and then I got, like, probably a few months after that, I got really sick with COVID. And then about a month after that, full-blown lupus. So it's just interesting how much you've been seeing yourself, Margaret, but also, some of the other holistic doctors and functional doctors that I've worked with are also seeing it.
Oh yeah.
So crazy.
I mean, there's studies. I mean, that one I just showed you just came out in April. But are we seeing it on the news? You know what
Oh
I'm saying?
no.
It's like, it's like a hidden, it's like such a hidden thing. It's the whole thing is just a little bit mind-boggling to me, because why don't we talk about like how good vitamin D3 actually is to prevent infections like this? Like, how much is a bottle of vitamin D? Like maybe $20. It's insane. So yes, so I had to share that, what I see clinically, because it's been happening like one after another. And then I have women coming to me who are like, I was just vaccinated and my ANA was checked several months ago. I got vaccinated and now it's like I've been seeing, it's like 3 months from on the average from when I'm seeing conversion here. So yeah.
And then in terms of that, I know COVID in and of itself has a remarkable way of creating inflammation in our body. And I wanted to ask you, when you start cleaning up some of this stuff, like the parasites and the viruses and all of that, getting a handle on it, do you see inflammation starting to decrease and come down?
So yes, definitely. I mean, inflammation, pain, joint pain, headaches, so many things start to go away because I'm decreasing inflammation, not only by treating this, but sometimes we're doing like food sensitivity testing. I mean, foods that you might think are super healthy, like avocados or whatever it is that you're eating, like, or eggs even. That's such a common food allergen. You're eating it every day. You got used to being tired every day. You don't know that it's the eggs or the avocado, and you're consuming it without knowing, and that's just creating inflammation. And so that's why I do a bunch of different functional tests to really like, oh, you have to stay away from these foods for like 9 months. And the pathogens, all of that. Once you start giving the body what it needs, it heals. And so, but I'm not doing it. I have to make sure that the person is being supported through supplements and food. And so like, I have to have them, we have to start there also, because I can put someone on, here's the parasite protocol or the H. pylori protocol, and they're like severely deficient.
Yeah.
You know what I mean? So it starts with building the person up as we're getting ready, making sure they're not constipated. I cannot have anyone constipated. So we work on having them going on a regular basis and having bowel movements every single day. 1 to 2 bowel movements is a must. And so preparing the body to start doing this. And we do things really slow. And so people aren't having like Herxheimer reactions, which is major fatigue, or maybe having like major headaches. We're doing things really slowly. Low dose first, and then we bump it up a little bit and see how you do. And so that's sort of my approach.
Awesome. Thank you.
You're welcome. Anybody else?
I have one more question since we're on the autoimmune train here.
Sure.
Lichen, I think it's called lichen sclerosis.
Uh-huh.
What do you know about that as far as like root cause, like parasites? Is it just kind of like the same as everything else, or is there one thing or two things that you have seen in your practice that kind of keep coming back to that?
Really good question. So lichen sclerosis, typically I've seen it vaginally. Women will have it and they'll have it chronically. And when I used to have my office in the city, I used to do something called PRP vaginally, which helped lichen sclerosis. I don't practice I don't have an office anymore. So I used to see some improvement there, and that was using like stem cells also to help recover. But for the most part, when a woman has that, I still go through, because it's still skin, right? It's skin. And when I see skin issues, I think of gut issues. And so there's certainly tons of like topical creams, there's prescription stuff, I've never seen a woman like fully heal from that using all of those things. Now, I can't say that I have a ton of experience working with women with lichen. It's mostly autoimmune. But when I did see them in my practice, I did some PRP. I saw some mild results. I never really necessarily saw full eradication, but they came because they only wanted PRP. They didn't want to do the stool testing or the other things. So, yeah.
Okay.
Mhm.
I'm just kind of, I'm learning a little bit more about it. I have Hashimoto's and Graves' disease. And through just diet and lifestyle, I've been able to bring my numbers down to where they're not visible anymore. So it's
Amazing.
in remission at the moment. But I've kind of self-diagnosed myself with this because I had a injury there. Like as a little girl, I fell on a slide and I had an injury there that kind of cut the skin. And it healed just fine. And then after I had my first daughter is when I started to notice some of that itching. Although I'm not pained by it or anything. It's always stayed in the one spot and it doesn't bother me at all. But the skin tone has changed a little bit. It's kind of like lightened up, but I was just curious where that connection could come from. Because from my research, it looks like it could be somewhat of an inflammatory skin condition.
Sure.
I just didn't know if it had any autoimmune, like underlying, is it, autoimmune kind of thing.
So for me, even if it were, so it's inflammation. And so
Right.
let's just say we called it autoimmune. I'm still looking at the same places, like what triggered it, what's causing it, what's feeding it, why is it there, what can we do? For me, it's always stool testing. It's blood work. And then depending on if there's other symptoms, it usually doesn't happen alone. Usually there's other things, other little symptoms that are like, oh, I get these sinus infections every year. And I'm like, oh, okay. Well, we got to look at the gut because thyroid and sinus issues are directly correlated to the gut. And so, I see primary care providers all the time giving antibiotic after antibiotic after antibiotic when a person's like, I still have sinus infection. I still have pain here. And it's really, or it could be mold too. Mold is another one. But giving over and over antibiotics is not doing anything good for the gut at all.
Do you have a
question? Oh, sorry.
Well, that's okay. Do you have any recommendations for somebody that has been antibiotics recently to help with rebuilding the gut beyond like probiotics and fermented foods and things like that? Or is that kind of
I would say that would be a big one. Now, we don't know what's actually been sort of wiped out. I did recently have a client of mine who was, when she had her initial stool test with me, and then we redid it. And I was like, oh, all of your good bacteria is like on the low side. And I said, have you been on antibiotics? She was like, yeah, like a month ago. So it eradicates it. And you would have to be on the probiotic for a while, and making sure it's at least a good combination of lacto, bifido combination. Yeah. Anything else, anyone? No one? No one? Okay. So I've got a couple of links here. I have a discovery call if any one of you are interested in talking to me about what's going on in your health. If you would like to work with me, I also have the other links. One is to purchase. I also added mold test in there because a lot of people ask me for a mold test, but I have the stool and the mold test, and then a couple of different ways if you'd like for me to interpret them for you. If you want to work with me personally, then those are different prices. This is, I mean, if you just are like, I just want a stool test and tell me what's going on, and then I give you my recommendations for like supplements, then that's what this is. If you're like, no, I think I want blood work and I think I may have some food sensitivities, then just schedule the meet and greet. I usually tend to do those on Mondays and Tuesdays. So that is right there, the meet and greet discovery call.
Margaret, this is Christine. I'm sorry, I had myself on mute before.
Okay.
If I could ask a quick, this could be a quick question. I
Hey,
didn't
go
know
ahead.
if you saw any correlation or any patterns in your work of connections between trauma and autoimmune disorders. And I ask that only because I was in a car accident a few years ago and had severe post-concussion headaches. And then in the course of treatment with that, was diagnosed with psoriatic arthritis and polymyalgia rheumatica. And one of the neurologists that I saw said, you know, this is only an anecdotal observation, but I'm going to start keeping track of the number of patients I see that develop autoimmune disorders after car accidents, which, you know, was just a really interesting, and this was at a Boston hospital. It wasn't, you know, I mean, it was at a research institution.
Sure.
So it was just really a really interesting observation to me. And I didn't know if you, I don't know, you know, between physical trauma or emotional trauma, or if you ever saw it, if you've ever made note of any kind of pattern like that.
I love this question. 1000% correlation. 1000%. Every single one of my patients has had trauma, whether it has been physical, emotional. There's something called the ACEs study, ACES study.
Okay.
And it gives you a series of questions, about 9 or 10 questions. You can find it online very easily. And it talks about all the different traumatic events that could have happened to someone that has created or led to autoimmunity. And it doesn't have to be anything major. It doesn't have to be, well, for you, it was a car accident, which is pretty major.
Mm-hmm.
But for some people, it was being bullied at school. You know, something where you may think like, oh, that happened a long time ago, you know. That affects children. I mean, you know, if they're being bullied in school, it does affect them as adults. So 1000% have I seen women with autoimmune after having some form of trauma.
That's so interesting.
It could be what we call big T trauma or little T trauma. So both exist and they're correlated for sure.
Thank you.
You're welcome. Anyone else?
Okay, I have one more question because I'm full of questions. I'm in my bedroom fighting a cold right now. That's why I sound so stuffy and crummy right now. My little one passed it along. Do you suggest for those with Hashimoto's and molecular mimicry taking away gluten and dairy like forever? Like, what are your thoughts on that with autoimmune? Thyroid autoimmune. And
Yes, I would say dairy number one,
yeah.
like yesterday.
Yeah.
Yeah.
Because I eliminated it along with gluten. And I think that was a big, huge contributor to my remission. But I've slowly been able to reincorporate more K2 dairy, which is, you know, like goat's cheese and things like that. And I noticed I don't have any type of reaction to that. So I was just curious, just what your thoughts were on that and just your past history with.
Oh yeah, it's a must. When I work with women with any form of thyroid, hypo or hyper, and I have worked with women with hyper. By the way, did you say you were hypo or hyper?
Oh, well, I have, yeah, Graves and Hashimoto's, so both.
Oh, so you have both. Okay.
Yeah.
So conventional medicine says if you have a goiter, if you have hyperthyroidism, there's 2 ways we can, you know, deal with it. We kill it with radioactive material,
Yeah.
or we completely surgically remove it.
Mm-hmm.
I have not done obviously either one. That I don't believe in that. I have reversed it through herbs, through gut, through food sensitivity testing and all of that. So number one thing, gluten is correlated with Hashimoto's. Mm-hmm. Hands down, get off the gluten. That's one. Heal the lining, because that gluten has also been damaging the lining of your gut. And so that healing needs to happen in order for you to fully heal the thyroid as well.
So with dairy though, do you recommend it like lifelong? I know gluten pretty much is like off the table, but as far as dairy goes, even after healing the gut.
I would say for me, well, one, I would have to check a food sensitivity test to like 1000% determine yes or no. Typically, a lot of people, initially, their food sensitivities will come positive because when you have gut issues and you've had them for a while, you tend to be sensitive to a lot of foods. Dairy, I will say at least 9 months off, 100% off of it. You can start incorporating and see how you feel, but if the food sensitivity test shows positive, then they do not introduce it.
So just bio individual. Okay.
Yeah.
Cool. Thank you.
You're welcome. Anybody else? I'm curious, was there any infection that you wanted to hear about, but I didn't talk about? Just curious. Anything?
Maybe like Lyme disease.
Yes, Lyme. Lyme is one of those things that is sometimes misdiagnosed, as in people are diagnosed with Parkinson's or they're diagnosed with lupus and it's really Lyme. And I don't know if it necessarily triggers an autoimmune condition, but it's confused as some people don't test for the right things when it comes to Lyme. And so it looks like it's negative. If someone does a Lyme test and they're like, they just check for a Lyme IgG and IgM. Those aren't good tests to be run. So I don't know necessarily if it triggers it, but it's certainly something that's not readily checked often enough. And then they'll check for lupus and be like, yeah, well, we think you have lupus, when it really could be Lyme.
So what test would you recommend that would be beneficial?
I like it's called the tick-borne panel. It's through Quest, the PCR. I like that test. That test for the different, the babesiosis, like all of them. I think that's a good test. Obviously, there's more expensive ones too.
Just read a lot of times that it can be missed in a lot of testing.
Yes. IGenix, IGENIX is it's an expensive test, but that's probably one of the most ordered tests in order to sort of confirm. But if it shows up on Quest, there's like no doubt about it. Like you've got it if it shows up on a Quest. And I've had lots of times when it showed up on Quest. Even when I've repeated it, it'll come back positive again. So sometimes you don't need to do it. I would start like with just a Quest test. I don't know if LabCorp, I don't know if they have on the tick-borne panel or not. No one.
In terms of food sensitivities, do you recommend getting that retested, or once you have a sensitivity to something, it's tried and true and always the case?
No. Great question. Once you heal, a lot of those food sensitivities fall off. And the ones that stay on then they're just food sensitivities. But the more you have, it's most likely due to gut issues, gut lining issues, permeability issues. And it does take some time to heal that. So I probably wouldn't repeat it for another 9 to 12 months after.
Okay, awesome.
But it doesn't mean that, because when initially, like way back in the day when I was first diagnosed, and food sensitivity test was like 3 or 4 pages long, I was like moderate to high on so many. It was, I'd say, more than half. And so you can heal from it.
And would you say that the food sensitivities you had back then, were they obvious ones, or were they ones where you're like, damn, I didn't know that that was even bothering my system? I know gluten was one of them, but.
No, I was reacting to everything I ate. I mean, I literally was reacting to like water I was drinking.
Okay.
I would
I only laugh because I know lupus, so I know how it goes.
Yes, yes. I mean, I had it bad. I had so many food sensitivities, but you heal the gut and things come off that and whatever's left over. So this year I did my food sensitivity test because I'm like, I've just been having like a little discomfort after I eat. I don't know what's going on. It came back for things that I didn't even know I had an issue with. One was coffee, which I'm not a huge drinker of, but I eliminated that for about a year, and I kind of incorporating it a little bit now and then, and I have zero issue with it. And what was the other one? Oh, blueberries. So I cut that out and I'm like, oh, no wonder. You know, you think back and you're like, no wonder. I've been having those, blueberries like almost every day and not feeling great after. But you don't think, because you're like, blueberries so healthy, right? And it could be a really healthy food that you have sensitivity to.
Okay, that makes perfect sense.
Yeah. All right. Anything else?
I have one last question, kind of going back to the gut. You'd mentioned doing sort of a follow-up test about 9 to 12 months in. Does it typically take that long if you have leaky gut or any kind of permeability? Does it take that long for it to heal?
Yes.
Okay.
It doesn't take that long for you to start feeling better, because I have women feeling better within a couple of months or sometimes even sooner. But to heal on a deep cellular level, it can take 9 to 12 months. And for some people that are really chronically ill, it can take 2 years.
Yeah. Okay.
Yeah.
Okay. Thank you.
You're welcome. By the way, I wanted to find out, obviously you all found me on Instagram because it's the only place I really am. I would love if you found this valuable, or maybe something that you learned, if you can like give me a little shout out on Instagram. I'd love to know sort of your takeaway and what you thought about this class, or like maybe you learned something that you never knew before. And tag me in it. I'd love to see it. I'd love to find out. All right, I think it's been an hour and a half. And you'll all be getting the replay as soon as I just re-record the beginning of this first few slides, and you'll be getting all that with the links and all of that. But if you see the links here and you're interested, you can just click on them and save that page. All right, ladies, have an amazing night. Thank you so much for showing up live, and I'll see you on Instagram.
Thank you.
All right, you're welcome.
Thank you. It was wonderful.
Oh, thank you so much. Have a good night.
Take care.
Bye. Thank you.
All right, bye.